Hello, everyone. Thank you so much for joining us today for part of our webinar series here at McGuireWoods for healthcare add-on acquisition integration. We're going to talk a lot about the different topics that I know a lot of the attendees on the call are facing related to getting a transaction done and then integrating the business that you or you've bought or you have been bought. We have the pleasure today of having with us a partner to produce the webinar, Jarrard and their partner, Hollie Adams. And she's going to be speaking about a number of practical topics outside of the legal front. She is a partner in the healthcare services practice lead at Jarrard and will be presenting the second half of the webinar. The first half of the webinar today is going to be presented by myself. I'm a partner at McGuireWoods' healthcare team, and one of my colleagues, Diana Castro. You're going to be hearing from us about the legal concepts of integration, and then Hollie's going to talk a little bit more about the practical aspects. But before we get started, I wanted to just start with a couple of housekeeping points about the platform. I see that most people have been able to log in pretty successfully. You probably see on your screen that there is a Q&A box. We are taking Q&A. If you have any questions, please feel free to submit them to the box. We'll try to address them as the discussion goes. But if we haven't hit it by the end of the presentation, we'll come back to it at the end, or we'll reach out directly to you by email. And then, of course, we've listed all of our contact information here. If you'd like to reach out to us, we're always happy to have a conversation about these specific topics. And we often get questions of whether or not the slides and the recording will be available at a later time. That will be sent around to all of the attendees automatically by the platform by tomorrow. So if you want to rewatch a portion or take a look at the slides, those will become available. So before we get started, I just wanted to take a minute to tell everybody a little bit about McGuireWoods to the extent that you aren't familiar, and then Hollie will tell you all a little bit about Jarrard a little bit later in the presentation. But the McGuireWoods team, which Diana and I are a part of, is about 1,000 plus attorneys across the country. Diana and I both are part of the McGuireWoods healthcare group that focuses solely on healthcare transactions and healthcare regulatory issues for clients every day. We're lucky to be a part of a 50-plus group of attorneys who devote their time to that particular specialty and practice area. And many of us bend heavily from a transactional perspective. So I think the last I saw in 2021, we were about $6 billion in deal value, more than 120 deals, and certainly many different platform and exits. So we have quite a bit of experience in the different areas related to deal making, but also the operational integration and growing the businesses post-deal. And that's really what we're going to focus on talking about today, is the different issues related to integration. So based on looking at everyone that is logged in on the attendee list, most people are heavily involved in physician practice acquisition. So what I'm showing you on the slides is probably no secret to anyone, which is the relationship that non-clinical entities have to clinical entities. In most states around the country, as most people know, there is a corporate practice of medicine restriction, which requires clinical entities and non-clinical entities to have respective roles. And during the transactions, we work on a lot of those elements, either through services agreements or governing documents, and that's a very important element of many negotiated transactions. It is equally important that each of these items are operationalized properly, such that the practical structures and the practical delineation of roles is respected and viewed properly post-closing. So just for anyone who's not familiar with physician practice structures that we see very frequently, this is just a high-level overview where you have the practice entity responsible for different clinical responsibilities and the management company and non-clinical investors responsible for the non-clinical relationships in exchange for a fee to assist clinicians in expanding their business and assist them in taking some of the non-clinical responsibilities off their plate from a day-to-day basis. So the question becomes, how do we operationalize the structure? How do we make sure that those distinct entities are performing the services that they were intended to perform based on what was negotiated during the transaction? So here's a listing of items that we typically see that the management company is responsible for versus the practice company is responsible for. And then we're going to talk a little bit about the various integration considerations for each of those different elements. So the first that I wanted to talk about is real estate leases. In most states across the country, it is permissible for real estate leases to be held by either the management company or the practice entity. That's going to vary state by state. That's not an absolute rule. Some states have different restrictions where they must be held at the practice entity. Some allow it to be held in any place that they'd like. But making sure that in connection with a transaction that you're properly integrating the real estate and you're making sure that the leases reflect what is actually happening, and then also making sure that security deposits and the individual accounts where payments are being made for those real estate payments are following the lease relationships are very important. And that's something that in operational integration, we always encourage our contacts to look at very critically. The next is bank accounts. So these two entities are separate legal entities. They have separate responsibilities and separate rights. In every situation, we see them having separate bank accounts, and they make sure that they are administered separately. They have signatories that are appropriate for that individual entity and the governing documents of that individual entity. So that's something that in connection with operational integration, we encourage everyone to look at very closely and make sure it's set up properly. And that wasn't something in the rush of the deal that people glossed over and didn't focus on. The next issue is employee benefits and employment agreements. So as a high-level overview, the practice always will employ, of course, the clinical personnel and be responsible for the clinical responsibilities. So often that will include things like nurses, medical assistants, mid-levels, physicians. And in many practices, some of those groups of people have employment agreements. So making sure that the employment agreement is operationalized by the correct entity and the correct entity is paying the salary associated with those accounts out of the correct entity is very important to comply with the various requirements. Separately, many relationships like this, the MSO is required to have employees in order to furnish the administrative services that they're required to provide under the administrative services agreement. With those employees come obligations of benefits, payroll policies, and different other issues that have to be stood up and examined to make sure that the benefit plans are correctly administered and that we're not, again, treating the entities like one and the same, but instead they're being respected and treated based on their own governing documents and their own responsibilities. So that's something to make sure that's being audited frequently, reviewed frequently, so it's being done properly. The next is on equipment and maintenance. So any clinical equipment in most states is required to be provided by the practice entity. So in that situation, it's very important to be mindful that the maintenance contracts, the equipment, anything that's necessary for that equipment is either sitting at the practice and correctly documented with the practice and tracked in that way internally, or equipment maintenance is included within the administrative services agreement and that is operationalized properly. Failing to do that can make it very tricky for the relationships to comply with the terms of both the governing documents and the services agreements. The next thing from an operational integration perspective that we always encourage our clients and contacts to look critically at is payer contracting. So many of you on the phone have probably heard that the antitrust climate with respect to payer contracting and payer issues has really increased. The FTC has changed some of their guidance. They've repealed some guidance, which has made a little bit of a vacuum when it comes to exactly what can be done in the healthcare space. And so being very cognizant that to the extent that you are contracting for different payer arrangements, you're doing so in compliance with the various antitrust rules is very important. And so putting in place antitrust policies, putting in place payer contracting policies, and to the extent necessary, putting in place clean team or other firewall agreements internally are very important in connection with operational integration. So that's something that we just highlight that is important to take a look at, especially in practice add-on structures and other healthcare relationships. As soon as a transaction closes, many times the individuals involved in the transaction will have received licensure charts, contracts charts that they can then use to migrate over into integration. So one of the very important elements that we see our clients that are extremely successful implement is a close coordination between the M&A team and the operational team in making sure that there isn't any seepage when that transition occurs. So we always encourage our clients and contacts to ensure that to the extent there was a contract analysis done during a transaction, to the extent that there was a licensure analysis done during transaction, use that as the basis for crosswalking over into your operational integration, and then load that information into whatever system management that your organization uses, and then track it from there. Track the renewals, track the without cause termination provision, track termination penalties to make sure that that information is being inputted from the outset. It will make it a lot more seamless going forward. It's less likely there will be a licensure process or something like that missed. And then the last thing is on reporting structures and oversight. With respect to all of these elements of integration, it's very important to make sure that the reporting chains are appropriate for the legal entity and the service that's being provided, and the oversight is appropriate as well. So for example, we will see many of our clients and contacts implement a clinical governance charter or clinical governance structure within the practice. So there is a group of individual clinicians that are reviewing constantly, whether it is looking at charts, looking at billing and coding, and all of this is done in connection with the management company supporting the administrative functions, but at all times the practice is retaining the clinical functionality and the clinical review capacity, and ensuring that those reporting structures, the minutes that go with them, the integration responsibilities is really important to make sure those elements are continue to be respected. The next is just a few other considerations that we included on this slide for your review. Many of these topics we've already talked about. There's just a couple of things that I wanted to highlight in particular. When we talked about the administrative services arrangement in the previous slide, that was entered into at the time of the transaction. Many of our clients choose to revisit that agreement, revisit the valuation of that fee structure on a regular basis to ensure that they're maintaining compliance and to ensure they're monitoring that ongoing operational integration point. So that's just something to flag that is a common approach that many on the phone may want to think about. The other thing to flag is there are several states around the country that continue to have an active practice requirement with respect to anyone who owns or is an officer of a director in a particular practice entity. So to the extent that your state has that in the relationships that you're building, it's important to monitor and continue to document that you're meeting those active practice requirements so that you can make sure that the ownership and structure of the relationship is staying in place and is appropriate at all times. The other component is some of you likely have states that allow direct investment by the management company or direct investment by non-clinical individuals. So states like Arizona, Florida, to the extent that you have relationships in those states, the license that you're required to obtain and the survey requirements that are required to be put in place are very important. And to the extent that that license would lapse, or you would not be in compliance with the requirements, it could be very detrimental to the overall structure that you are putting in place. So that means that operational integration for those items are very important because you can make sure that those are being crosswalked over, tracked closely, and there's never a situation in which that could lapse or not meet a renewal. So with that, I'm going to turn it over to Diana to talk about a few other topics related to practice integration in more specificity. So things like your EMR, your policies and procedures, compensation, culture. Diana, do you mind to take these?
Yes, thank you so much. So as Kayla mentioned, the next few slides will cover integration topics in a little bit more of a granular specificity. So beginning with electronic medical record systems, when an add-on platform or when an add-on practice goes onto your state-specific platform, that is the opportunity to transition them to the electronic medical records that the platform uses. And so it would join the same contract that the platform uses, and this creates, of course, the economies of scale, and it makes the transition much more seamless and efficient. And from a HIPAA compliance and record keeping standpoint as well, it facilitates the transition, and it brings to date as well some of the smaller practices that historically have not had as detailed of HIPAA compliance and record keeping structures in place. It brings them into the compliance that you've already established with your state-specific practice platform. The second point, as Kayla mentioned, of course, the ownership of patient medical records has to remain with the practice or the physicians who treat the patients. The patient medical records are never transferred over to the MSO. One thing to consider as part of the transition, you should also ensure whether there are any patient notices or postings that should be required to notify the patients of the change in ownership or the change in branding of the practice under any applicable state or board statutes or regulations. And this may be something that is flagged by your legal counsel on a pre-closing basis. So it's often included in a diligence memo or in some sort of checklist for you to consider on a post-closing basis. From an operational policies and procedures standpoint, again, this is an opportunity for the add-on practice to join or to implement the more fulsome policies and procedures that you may already have in place, either in that state or if you're entering a new state in one of your other practice platforms. And this is also one of the most common diligence issues that we see in transactions with smaller medical practices or any type of healthcare practice, really, is the lack of fulsome written policies and procedures, ensuring that your compliance plan satisfies the OIG's 7 elements to a compliance plan, HIPAA policies and procedures, best practices for protecting patient records. That this is all, again, an opportunity to make sure that your add-on practice has in place the up-to-date and fulsome policies and procedures. Supervision collaboration agreements with mid-level providers is another area where we see a lot of opportunity for improvement. So that would also be flagged in a diligence memo, but ensuring that any supervision collaboration agreements required, first of all, are in place, and second of all, are meeting all of the required elements of these agreements that are set forth by the respective boards. With respect to compensation and bonuses, obviously physician compensation is negotiated during the transaction stage. But for all of the other employees, particularly the employees who transition from being employed by the practice to now being employees of the MSO, this is an opportunity to ensure that there is a uniform structure, an equitable structure, because now all of these people are under your one umbrella operationally in terms of the administrative staff. And similarly with the workplace culture across different offices. Of course, this isn't something that happens overnight, but we work with clients who try to implement a cohesive culture, and again, it happens over time by bringing their employees together and creating opportunities for work across different offices. Other items to consider are you now have the efficiency of having shared form documents, often in connection with closing, right? Clients will update the websites of the acquired add-on practice to create that uniformity and cohesiveness among the platform. Patient documents, you will now have one set of robust forms. And this will include, of course, billing and payment policies, the notices of privacy practices that are required under HIPAA, all of these payer type of related notices. You will all be bringing it into one updated form. Practice entity governing documents. These are often prepared in connection with the transaction. And it's helpful for the operations team to review these, and particularly around the governance, because as Kayla was mentioning, it's very important that the MSO and the practice entities continue to be treated as distinct legal entities, and that we're respecting each of their own decision-making processes and authorities. And so helpful to keep track of items that the practice is approving, if required to, under the practice's governing documents, just to maintain that paper trail that shows that you are meeting the business corporate formalities of keeping the two separate legal entities. Template agreements, you will now, if you're entering into a new state, you'll have new template agreements, or if you've already established them, this will make hiring or preparing employment agreements in the future much more efficient, and something that some of our clients do in-house and then send to their attorneys for review, or if they want the attorneys to prepare them, it keeps everything very consistent and efficient. Then transitioning to change of ownership and other government considerations. Kayla also touched upon this briefly a few minutes ago, but in connection with the transaction, you should likely receive or request that your attorneys prepare for you and provide you a change of ownership chart and a contract chart. And from a licensure perspective, a change of ownership chart will show you all of the licenses that were disclosed during the transaction process, and whether any change of ownership notice or consent requirements are triggered by the transaction, and if so, what the timing considerations are for making those filings. Many regulatory licensure CHOW or notice requirements tend to be on a post-closing basis, but there are very strict deadlines to keep in mind, and it can be anywhere from 15 to 90 days. So, sometimes when by the time we get to the finish line, there's been a lot of work done, obviously, and a big push to close. But we do need to be mindful of then that, closing starts the clock ticking on making those regulatory filings. Another item to consider are the post-closing due diligence recommendations. Again, this is in connection with the closing of your deal. You should be receiving some sort of diligence memo or red flags, email or chart, or anything that flags what was uncovered during the diligence process, and what the post-closing recommendations are. And to the extent there are any that any post-closing recommendations, we do recommend that you consider implementing these promptly on a post-closing basis, because to the extent that there was any potential liability arising from conduct pre-closing, that should be captured under whatever indemnity is negotiated in your transaction documents. But if you continue to engage in the same conduct on a post-closing basis, then you would potentially be incurring that liability on your clock, and therefore it's unlikely you would have any liability indemnification protection. So we do encourage clients to make sure that they're implementing any post-closing due diligence recommendations as quickly as possible. Some common diligence issues that we see in the smaller add-on practices, as I mentioned earlier, is the lack of robust policies and procedures. Some practices may not even have any if it's a solo practitioner somewhere. So implementing, again, policies and procedures, HIPAA policies and procedures, quickly post-closing, employee manuals. Quickly post-closing is one of the easier boxes to check to ensure ongoing compliance. We also see common diligence issues around marketing, and so again, ensuring that you have compliant marketing practices and policies in place is crucial to, again, cutting off any potential liability. Then in connection with the deal, also as Kayla mentioned, you should be getting some sort of contract chart or summary of the existing contracts that were in place prior to closing, to making sure that you're adding this to your repository of existing contracts at the platform will be very helpful and will make your life a lot easier in the future to keep track of key terms such as expiration dates, termination rights, payment terms, and both from an operational standpoint and then in the future as well, if your platform were to sell, having all of that together will make the diligence process that much smoother. Some of the considerations too around these contracts will be which agreements are assumed at the time of closing, to the extent there's any duplicative agreements in place or agreements that are already in place at the practice level, at the platform level that the add-on already has. So, for example, one might be a medical waste agreement, like a Stericycle agreement that most obviously practice entities already have, and an add-on might already have as well, ensuring that we are deleting any duplicity and again capitalizing on the efficiency is helpful there, and again useful for to reference the contract chart. To the extent there's any equipment agreements that come over, ensuring that and this is another item too where you might continue to work with your attorney, but ensuring that any lien terminations are properly filed upon payoff at closing, to the extent that there was any debt or liens that were filed on those prior to closing. That's an item also to keep in mind and to make sure, again, best practice once it's paid off, to ensure that the lien is released. And then post-closing transaction open items as well that were flagged either in the diligence memo or in some other format, but ensuring that anything that we push to post-closing in the interest of getting the deal done, right? So this might be obtaining some vendor notices or consents for contracts that are being assigned, things like that we complete on a post-closing basis. And then payor considerations. This is an item too where it may depend on the transaction structure, if it's a bifurcated sign and close versus simultaneous sign and close, and how the credentialing process, what your preference is. So in a bifurcated sign and close, you might have time to do to get all of your incoming physicians credentialed. But if it's a simultaneous sign and close, often what we'll see clients do is what is referred to informally as borrowing the payer contracts from the seller practice. And to do so, we typically use some sort of interim services agreements between the two practices. So ensuring that if that's the pathway that you're using, rather than doing a bifurcated sign and close, that you do have the paper to back it up, and you're not just informally using payer agreements or numbers, billing numbers from one entity to another. And I know we want to pass it off to the Jarrard team, so I will skip this last slide, which touches really on insurance and a lot of the items that we've already covered. But here, just high level, I would flag that you should ensure as you're onboarding that your physicians are coming in with now onto your liability malpractice policies, and that each of the locations are added to your liability policies. And with that, Hollie, I will pass it to you if that's okay.
Thank you so much, Diana and Kayla. I'm excited to join you all today. I'm going to skip over here. So today we're going to talk through communication best practices for successfully integrating acquisitions. I'm Hollie Adams, and for about 20 years, I've been focused on healthcare strategic planning, marketing, and communications, really across the spectrum of national nonprofit health systems and for-profit hospital companies. And for the past 7 years, I've specialized working with PE-backed companies, MSOs, and PPM platforms to expand access and capture growth through market share, volume, revenue growth. I'm a partner at Jarrard and lead our health services practice. So for those of you who maybe aren't familiar with Jarrard, we are a strategic communications firm devoted exclusively to healthcare providers. And important to today's conversation, our firm wrote the book on healthcare merger and acquisition communications, now in its second publishing and available on our website if you're interested. As we kick off the second half of the conversation, I think it's important to first align on what we mean when we say communication, because it certainly can mean a lot of different things. For example, it can mean a press release to announce a new acquisition, or it can mean internal communications like an email or newsletter to bring those folks along. But when we say communication, we believe it's empowering your organization to find its voice, inspire trust, and leverage those relationships to make change happen. We recognize that everything is a communication. So what you say and what you don't say, what you do and what you don't do is communication. And even a shift in organizational culture following an acquisition is a communication. So as we're talking today about integration, we recognize that communication can also mean the difference between significantly nurturing or significantly undermining the speed of realization and the value of the investment. So as I was preparing for this webinar, I reflected on the various reasons integrations can either fail or falter. Things on the right-hand side of this screen, like, was the valuation too high? Or were we unable to fully realize the synergies that we'd set out to create in the first place? Were there financial or legal challenges that complicated the matter that Diana and Kayla discussed? And were there cultural differences that were just too much to overcome? As Diana pointed out earlier, some cultural considerations in particular to practice and office integration. But really the common theme in all of these, I think, could be summarized in these two words on the left side: overestimating and underdelivering. So if we overestimate or underdeliver on any of these, we create risk, which allows us to flip the script on that notion. For integrations to be successful, we must focus on setting the right expectations and delivering on those promises. So how do you do that? And how do we leverage the power of communication to ensure we are setting right expectations and delivering on those? So we're going to talk about 3 strategic imperatives. And the first is creating strategic alignment across stakeholders with a defined approach to integration. And a case in point, 2 years ago, a national value-based care platform with aggressive growth goals came to us. The leadership team recognized that the time to integrate their new practices onto the platform was their greatest rate-limiting growth factor. Leadership then set a bold vision and a strategic integration approach, and they did so with really 3 critical things in mind. First, they committed to a 90-day timeline to fully integrate new practices onto the platform. What they did, instead of thinking about the thousands of things that needed to integrate, they focused on the 5 areas of integration that would set them up for success. So these service areas they identified for integration were finance, operations, data, human resources, and IT. They determined these 5 areas contributed to immediate value creation to the practices in order to ensure that the practices jumping onto that value-based care platform would be set up for success. The second thing they did is they established an integration team. So they designated a leader, both from an enterprise platform perspective as well as on the practice side, who were responsible and accountable to facilitating the integration over that 90-day time frame. And then they defined that process for achieving these areas of integration, complete with a roadmap and timelines, milestones, responsibilities. We really took that and codified it into a standardized process, into an integration playbook for each add-on acquisition. And the results were outstanding. The platform was able to achieve high growth within, really less than 2 years, expanded their footprint into 10 states, onboarded more than 500 providers, and increased their patient base by 350%. So taking a look at their successful integration efforts and why they were successful, creating these 6 key imperatives here. They first assessed and identified integration priorities early through due diligence, and these priority areas were focused on near-term value creation onto their platform. It started with creating a clear understanding of their destination, and so mapping that out in an integration roadmap allowed them to align their team members to the vision and goals of the integration and to the timeline and the path for them to get there. They also align their integration strategy to the business objectives of that acquisition, recognizing that the value proposition for the practices joining the platform was really cost savings. And so at first, integrating financial data and IT systems very early on were critical to their success. They also took a comprehensive approach, so considering factors like cultural and technology integrations, operational alignment, and customer experience in mind. Unique to them, they established a dedicated team responsible for overseeing that integration process. So this created role clarity and accountabilities for integration. Broadly speaking, in our experience, this is often the most overlooked because there isn't usually a dedicated team. Integration becomes an other duties as assigned with no clear leader. So that team, really a cross-functional team, was critical to the success of this effort. We created a playbook with a rinse and repeat model for integration to help clarifying roles and setting those expectations early. And then finally, we created a communications and change management plan to bring employees along in that change journey. So as we pivot, that is actually our second imperative, taking a thoughtful, strategic, and human-centered approach to communications and change management. So just illustrating the chaos of change, integrating acquired practices onto a single platform is the hard work, and it brings about significant organizational change, from the structure and the processes to the people and the culture. And often these changes happen at the same time, or they overlap and compound, in which case team members are felt overwhelmed and really confused by what's happening and why. And so just a brief story, and this may sound like an organization you might be familiar with. A few years back, we were working with a national ASC platform that acquired a handful of new centers overnight. And literally it was overnight. As you know, these deals can happen quickly. And despite their agreement to wait a few weeks to inform employees, the physician partners were really excited and shared the news with their employees the very next morning. Their employees were shocked to learn that the physician partners had sold their center, and the physicians were, I would say, grossly unprepared to handle their employees' questions. The fact a lot was going to change, but a lot was also not going to change. And so they just weren't prepared to communicate or answer questions. And that led to an erosion of trust between the employees and the physicians, as well as between the employees and their new employer. So the result here was many of those employees left shortly after the acquisition. And then integration took a very long time and was costly to the platform. And so best practice, having well-planned and well-implemented communications efforts can certainly unify parts of the organization and also prevent these negative impacts. So looking at a communication plan that can help keep all stakeholders informed and engaged, we say early and often throughout the entire integration process, and providing context and connecting to the why of change. So here are just a few communication areas that we often think about and you might find helpful. Thinking about what needs to be communicated on day one, perhaps even what needs to be communicated with beforehand if possible. What's going to remain the same and what things aren't changing, what changes are happening immediately or in the near future. Why are these changes happening? And couching that under the vision. So giving employees and team members a vision for the future of what we're trying to create together. It's important to note here too, communication is two-way. So thinking about how we engage stakeholders along the journey of change. Where can they find more information? Who is prepared to answer the questions they have? How do we solicit feedback and engagement to help eliminate the chaos of change and serve as a resource to help our employees more smoothly navigate that integration process and set that acquisition up for success from the very beginning. Going back to the three imperatives, the last one will pivot a little bit from communication into branding and marketing considerations. So at Jarrard, we help develop brands and launch new companies. And, a quick story, a few years ago, a group of physicians and healthcare tech experts in a PE firm joined forces to revolutionize community-based oncology. And we were engaged to name the new company, shape its brand identity, and launch it nationally in collaboration with its founding practices. So at the time, the startup company, One Oncology, was, of course, unknown at the moment, and there were three founding practices with well-known names and strong reputations within their respective markets. We aligned their stakeholders to the new name and logo for the overarching network brand, and then in partnership with each practice, developed a co-branding strategy that you see here on the right-hand side to allow partners to build on their local brand equity and leverage the enterprise brand as an endorsement to also increase awareness and preference for that network brand. The public launch was successful in creating that awareness across the enterprise and has since experienced considerable growth since its inception. So apart from startup companies, we also help mature companies in high growth mode recast their brands. And one common question we often get is, should we be a house of brands or a branded house across the platform? And so what they're often referring to here is their brand architecture. And when we go to answer that question, there are several factors that we consider. So first is how the organization casts or may desire to recast its brand for growth. And this really ties back to the foundational elements of their brand. So their mission, their vision, their values, and what their story brand is and where they're headed into the future. We also consider enterprise strategy, competitive differentiators, and brand positioning. So we'll ask questions here about what does the company want to be known for? What do they not want to become? And how is that organization uniquely able to differentiate its services or products? Those are significant considerations to really reflecting on, do we create a house of brands or a branded house to cast a wide net around an enterprise? And then certainly there are market considerations as well, the business strategy, operations, and internal resources available to support the brands, the company's reputation, its competitive landscape, and certainly any kind of target that we may want to mitigate from a risk standpoint on having an enterprise brand across the country. All good considerations. I think broadly speaking, in our experience, brand strategy in healthcare often follows operations. So providers have to think about customer experiences, from whom are patients receiving their bills or their appointment reminders, and from whom are employees receiving their paychecks. And so often companies will adopt either a strategy, but we also see companies adopting a hybrid approach. I think just bottom line is there is no one size fits all approach to branding, and all of these considerations are important there. I'm going to land on a takeaway thought, and that is really every acquisition being unique, and the hard work is really in integrating those organizations successfully. So considering and aligning on the imperatives we talk through to the strategic goals of the acquisition. And helping companies establish strong brands that can guide growth and create a distinct position in the market, and help bring those organizational stakeholders along through change in a meaningful way, that they're connected to the why and the vision for what we are trying to accomplish. So recognizing that we are just a few minutes to time here, we are at the end of today's webinar, and just want to say thank you for joining us today. We hope you were able to take some helpful insights away from today's conversation. At Jarrard, we have several ways to subscribe to our thinking, and I wanted to put a shameless plug in. This Thursday, we are launching our latest special report. It's a national physician survey titled Beyond Burnout, Trust, Loyalty, and the Physician Gender Gap. So a first look into that report, you can go to the website noted on the top right of the screen, jarrardinc.com/subscribe for that first look. So today, to the extent that we were able to answer your questions, we tried to in real time, but should you have additional questions or would like to follow up with us individually, we invite you to do so. Our contact information is listed here on the screen. I want to say thank you again to Kayla and Diana and to McGuireWoods for providing a platform for today's webinar. We hope you were able to take some actionable insights away that you can apply in real time. Thank you so much for participating, and we hope you all have a great day.